Welcome everyone. Presenting to you all a new chopper in town, HARSHA-NAG. Well, as you can see here, it's very difficult to chop a fully grown tree with an axe. Yes, so like in a hard cutter. Ideally, a chopper should pierce the hard nucleus easily, like a butter knife through a butter, and give a good amount of lateral traction so that the posterior plate is separated. Various choppers are available in the market like Nagaharas, Minardi, Tisdale, Siebel's, Claw, Chang, etc. But the most commonly used among all these is the Nagara chopper, which looks something like this. It has an inner cutting edge with a blunt tip. It's a long horizontal chopper. Most of us also use a long diagonal chopper with the inner cutting edge, which is sharp, pierces the nucleus easily. So let's see what are the difficulties with these choppers. Here I am using a Nagara chopper. I am piercing the substance of the hard cataract. Since there is a very little space between the nucleus and the capsule, it becomes very difficult to go to the equator and crack the posterior capsule. So there is an incomplete crack. So I rotate the nucleus and try from the other side. Here I get success to some extent, but here also the posterior plate is not cracked. So what happens if the posterior plate is not cracked? You may eat one or two small pieces, but the whole nucleus comes out of the bag like this. Yes, so there are high chances of damage to the endothelium if the posterior plate is not cracked. Let's see one more case. Here I am using a sharp diagonal chopper. Since it doesn't pierce the nucleus, it gives undue lower pressure on the nucleus, so there can be a nucleus drop. So it would be best if you have an instrument like this, an electric saw, which cuts the trees within seconds to minutes. I got the idea of making this chopper from sickle. We have many sickles, different types of sickles in our part of the country. A straight sickle, it's very difficult to plow the garden, hard garden. Yes. We have a sickle which is bent slightly towards the left, especially to make some groove around the plant so that water can stay there. Here, see how easily it is plowing the ground. So based on this idea, I took a long diagonal Chang's chopper of around 2 to 2.5 mm also you can use, and bent the tip of around 0.3 to 0.5 mm slightly towards the left side in the form of a sickle. So the sharpness of the chopper is also not lost, whereas you get a good lateral bend of the chopper. This is something how it looks like under the microscope. A bent chopper. This is a HARSHA-NAG chopper. So you can pierce the nucleus with a sharp tip and also get a good amount of lateral traction or lateral force which is required to separate the nucleus and the posterior plate. This is how it looks under the microscope. This is a titanium HARSHA-NAG chopper. So let's see how it works. Well, this is a grade 4 nucleus. I am embedding the phaco probe into the substance of the nucleus. Diagonally I pierce the nucleus. See how easily it pierces and gives a lateral separation. This is grade 4 to grade 5 nucleus. I am embedding the substance of the nucleus with the HARSHA-NAG chopper and see how easily it cracks within a single crack. Yes, so the posterior plate is separated here. You can see the red glow there. So I rotate the nucleus 180 degrees. Repeat the same procedure onto the other side. See how nicely it separates. The posterior plate is fully separated. I divide these two big hard cataract nuclei into 4 quadrants. See again, you can see the red glow when you do the lateral separation. This amount of lateral separation you don't get with the normal straight chopper. Because of the lateral bend, you are getting this amount of lateral separation. So in hard cataracts, you can divide the nucleus into 8 or 12 small pieces. See, this is sub-chopping of the already chopped nucleus and emulsification of the nucleus and emulsify it. Well, I have a lesion Alcon machine, and so easily the emulsification is because of the torsional phacoemulsification power. So again, you can make the small nuclei into subnuclei and eat it one by one without chance of damaging to the endothelium. Since the force required to pierce the hard nucleus was less, and because of the lateral bend, the amount of force required for lateral traction was less, so chances of causing a nucleus drop is also minimized. So I rotate the nucleus, repeat the procedure, chop the already chopped nucleus into subnuclei little by little, divide it into 8 to 12 pieces and emulsify it one by one. This chopper helps in rotation of the nucleus also. Since the tip is bent, the chances of causing a PC rent with a sharp straight chopper is minimized. So you can see this is total hard black cataract grade 5 nucleus sclerosis. I embodied the phaco probe. See with the HARSHA-NAG chopper what a good amount of lateral traction you get. You can see the red glow there. So nicely the PCs are separated. Similarly, I repeat the procedure onto the other side. Since once the posterior plate is cracked, then the case becomes very easy. I divide the nucleus, as I said, into 4 big parts, then subdivide it into 8 parts, and during emulsification you can again subchop it into multiple smaller parts, 12, 16, depending on the hardness of the cataract. This is a grade 4 cataract. Well, this is a less leathery cataract. See, within a single chop you get the division of the posterior plate of the nucleus. So I chop the nucleus into 4 quadrants. Since it's not that hard, not that leathery, the amount of force required is minimal. So this sickle shaped bend at the tip of around 0.3 to 0.5 millimeters is the crux of this instrument. So this is a long diagonal Chang's chopper which I am using with the inner cutting edge and the sharp tip, which I bend it into the left side, giving it a good amount of lateral traction on the left side. See how the chopping of even the subnuclei is easier with this chopper. It also helps in rotation of the nucleus. So you are preventing damage to the posterior capsule, you are preventing damage to the endothelium, and piercing the hard nucleus, and the good amount of lateral separation or the lateral traction force required for this lateral traction is also minimized by just a simple maneuver, yet a very efficient maneuver or an efficient idea which helps in cracking the hard cataract code. Yes. So in spite of all those choppers, this is working very good in my hand. This is an intumescent cataract, but the nucleus is hard inside. See how easily this HARSHA-NAG chopper helps in chopping the nucleus. So after seeing grade 4 and grade 5, this grade 3 to grade 4 nuclei without any leathery fibers looks so pleasing to the eyes, so easy to operate. All because of this simple yet very efficient modification of a long diagonal chopper which is doing a good work. So anybody can try this. There is no patency, no legal issues. Yes, it's not a chopper, it's an emotion. Thank you one and all.